Get Healthy Cincinnati from the Christ Hospital Health Network and these local partners.
I'm Brian Mannion, and I'm the Medical Director of the Oncology Service Line at Christ Hospital. Typically, the patients that should be talking to their doctors about screening are patients who are run between the ages approximately 50 to about 65 to 70. Or if you have particular risk factors, you might want to talk to your doctor earlier. These would include a family history of prostate cancer, or if you're African American. There's several different ways to screen for prostate cancer. By far and away the most important is checking a blood test called the PSA. This is a test that can be taken by just drawing a single tube of blood from your arm, and this will give us information that will determine whether or not you might have early prostate cancer. PSA is a good tool to catch prostate cancer early because, first of all, it's a very simple test to do. It's very easy for patients to get the test done, and it gives a very quick answer and a fairly accurate answer as to what the status of your prostate is. Prostate cancer staging is just a method that we use to determine how much prostate cancer you have and help predict what risk group that you might be in. And so the staging is determined by a few things. It's determined by the PSA. It's determined by something called the Gleason score, which is something you get from a biopsy. And it's also determined by radiographic studies, for example, an ultrasound or maybe a CAT scan or MRI or a bone scan. Yeah, the Prostate Cancer Collaborative was conceived because we had several physicians here at Christ Hospital who really wanted to streamline patient care. Right now, prostate cancer at many institutions is treated by many separate specialties, and so we thought by bringing all those specialties to the patient so that he could get a cohesive answer from all angles was very critical for good patient care. Oh, there's several treatments available. We have several different forms of surgery. We have open surgery, we have robotic surgery, we have several different kinds of radiation. There's something called external beam radiation. There's also something called brachytherapy, which can be given by implantable seeds or by even a newer method called HDR. And in addition to that, we have a lot of different medical treatments. We even offer some immunotherapy. So that really runs the full gamut just about of all prostate cancer treatment options. Well, here at Christ Hospital, we're very happy that we now have this HDR suite. What it is, it's a form of radiation. It's a way that we can treat patients who need radiation for prostate cancer with a very high dose of radiation given in a very short period of time, where you can get the dose of radiation exactly where you want to get it and without having side effects because of radiation that goes to places that you don't want it to go. So it really is a way to focus that radiation exactly where you need it.
Brought to you by the Christ Hospital Health Network, 5WLWT, and The Inquirer.